So I wanted to talk with all you today about some of the trends that we're seeing in the wellness industry and also thinking about the trends that we're seeing in the workforce as the nation is in process of going through this great resignation that I'm sure all of us have heard about. And so when I think about those two trends, it's important that we remember to take a step back and think about how those trends are directly correlated to what employees are experiencing and what they want out of their employer. When we look at wellness programs in general, their benefits behind wellness programs have been evident in helping to improve employee productivity, helping to improve employee morale, giving tools and access to your employees so they can understand how to maintain a healthy well-being, and then having that in turn helping to reduce healthcare costs within your organization. And so when I think about some of the problems that employers and employees have been struggling with now, especially due to the pandemic, it's important that we understand what those employees' needs and preferences are and pivot, right? Throughout this pandemic, we've had to pivot and change and adapt to a lot of different things within our livelihood, and knowing how to reimagine some of those rewards that are offered to employees is going to be really helpful in helping to solve those two problems of preventing your employees from either maybe resigning from your organization, and then also knowing how to take care of your employees' overall well-being. So from this PwC survey, we've seen that mental health programs have increased or been enhanced 53%. And that is something very evident. I can say mental health has been a big topic of concern for many people throughout this time. And it's going to be a topic of conversation that will continue. So offering services on how, again, we can ensure that our employees' well-being is being taken care of is going to be really important. And then looking how wellness programs have also increased 44% during this time period too, is giving your employees now these tools on how they can manage their well-being throughout these changes that we've all been experiencing. And so I really just think this speaks to some of the trends that we've seen with our own wellness program and how it can really be a big solution in helping to solve those problems with taking care of our employees and preventing our good employees from being lost.
All right, Stephanie, I think that's a great way to frame the discussion. And you're right, like wellness is needed now more than ever. I think a lot of employers recognize that over the past 2 years, and it shows up in this result, right? 44% of employers are increasing their wellness program, or they're adding one if they didn't have one before. So what we want to encourage you all to do is think about how are you engaging your customers, your employer groups with wellness programs. And when I start to have this discussion with our broker partners, I often get the question, well, what exactly is wellness? And what makes up a wellness program? Because it can mean a lot of different things to different people. So we're going to just show you a few examples today of what some of our customers have done over the past few years to enhance their wellness programs, and what some of the new wellness programs have been rolled out again over the past few years. And I'm just going to frame it in kind of two simple ways. One is make it easy to understand, keep it clean, keep it simple. But you've also got to meet the customer's needs. And sometimes that means we've got to customize things. And I think that's where the difference card in general really shines. We have been able to customize things for our customers to really meet their needs and get them to the end result that they want to. But it's a balancing act, right? You want to make it robust, but you also want it to be able to be easily understood by the end user, the member, and the employees of that group. So we're going to walk through a couple of client examples, and I'm going to start by talking through one of the more robust wellness goals out there. And this is an employer that used our points-based system, and they wanted their employees to achieve 50 points every 6 months in order to get the incentive that they set up. But it starts with, well, what's the goal? So think about the timing of that, right? Let's say it's a January 1st customer. Well, we're rolling out the goal at this time of year in December, and we're saying you have from December until July to complete some of these activities that equal 50 points. And then we're giving out the incentive when we get into the July period for those people that have met their goal. So some of the activities that were in this robust wellness program were a personal health assessment to get some idea on the health risk scores of that individual population, encouraging employees to get an annual physical. That's a big one. Flu shots, COVID vaccines, online health classes, the live webinars we do, and finally, the Goodcell testing kit that we're going to talk about later on in this presentation. So there's a lot of ways for an employee of this company to meet the goal, and that's what this customer wanted. They wanted a full-fledged, robust program with a lot of options for their employees. So for this group, what does it mean to actually meet the goal? What's the incentive? And they did it through our copay benefit structure, where they said, we're going to give an extra benefit on the Difference Card MasterCard if that member met their goal. And they're giving a pretty generous benefit, $25 off of every doctor visit if the member meets the goal. So without the wellness participation, they pay the $50 copay. If they meet the wellness goal, they pay the $25 copay. That can be a pretty big impact on the cost of health insurance for especially somebody that's using the healthcare system a lot. And that's what one of these types of incentive is meant to do, is to target the members that really use the healthcare system the most, so that you not only get the healthy people to participate in wellness, but you also get maybe some of the chronically ill, some of those people that need the most help. You get them achieving the wellness goals, and then they get lower copays when they go to a doctor, and that could be primary care or any of the specialists. Doing it this way is also a great way to do it on a pre-tax basis, because we're running it through the Difference Card medical expense reimbursement plan, the Section 105 plan, so it's deductible to the business, and the employees don't have to pay income tax on these copay reimbursements. So a great way to save money for the company and give a better benefit from an employee perspective. So the next logical question that I get from a lot of our broker partners is, well, what's the result? What are you seeing in terms of ROI? And it's not just about the wellness program. It's the combination of the wellness program with the Difference Card funding strategy. That's how we measure results and see what the achievements are. And it starts with engagement, right? We've got to get the attention of the population to make sure they know what the wellness program is, and we get them starting to participate in the wellness program. So for this customer, they were able to get 64% of their population engaged and actually doing something in the wellness category. That might be getting a physical, proving that they went to the gym a couple of times a week, getting a vaccine. Lots of different things can count as engagement. And then we had 41% of the population that actually met the 50-point goal in the measurement period for this group. And that's amazing compared to the national statistics on wellness participation. It's typically like 10 to 15% of the population actually gets engaged and meets the wellness goal. So what we found is by tying it to those copays, we can start to get higher levels of achievement and more employees actually meeting the wellness goal. And now we've at least got a chance of changing behavior and driving some results. So for this customer, we measured it over a longer period of time, a 3-year period. When they came into the Difference Card system, they had a pretty high loss ratio, 94% in terms of claims to premium. And we were able to help them lower that over a 3-year period to 85%, which is more towards the norm of what that carrier wants. So we're helping from a carrier perspective to lower renewals, and we're saving the group money off of their overall healthcare costs. All right, so that's example number one. That's the more robust program with all the different points-based wellness activities. Let's shift to another example, and this is more clean and simple. This is an option that we see a lot of groups start with. So they may be overwhelmed by all the point system, and a lot of groups say, I just want to start easy. So right, if we think about that PwC report, 44% of employers added or they improved their wellness program. Well, maybe if they're doing something today, they might go to that points-based system as a way to add to it, make it more robust. But if they're not doing anything today, a great way to get started is keep it simple. Let's just get the population to submit proof that they had an annual physical exam. Today, we know about only 20% of employees actually get their physical. And that's one of the most powerful things that we can do to change healthcare costs. If everybody gets their physical, we're going to catch things earlier. We're going to get their doctors more engaged, and there's going to be lower healthcare costs long-term, right? You might see a small uptick because people are actually just going to the doctor and there are tests being run, but that's okay if you can lower long-term expenses, prevent some emergency room visits because you've started to create that doctor-physician relationship. And then also for this group, they wanted to have a health assessment. So they did these two things: get an annual physical and get a health assessment completed during their qualifying period. And that's a pretty simple online assessment. They take it on differencecard.com once they log into our website, and it gives the members some feedback on what they can do to improve their health. It also gives the employer in aggregate some data on the risk profile of their group. And then you can take that information and really use it to shape the wellness program in future years, because you're going to have some information on what potential risk factors exist in your group, so we can shape the different programs around those risk factors. So this is more of that keep it simple, clean approach. But there does still need to be an incentive so that employees care about doing the wellness program. They care about getting their physical. So we found that carrot approach, giving a better benefit, giving a lower deductible in this case, is a great way to get people engaged, get them to actually get their physicals, take the health assessment. You're putting some money behind that wellness program. So this employer did it through their deductible. And they said, okay, if you meet the wellness goal, we're going to lower your deductible from $2,000 to $1,500. They gave an extra $500 off of their deductible. And that was pretty powerful. This group was able to get a lot of engagement because now they're giving some real dollars off of that deductible. And again, think about who cares about their deductible. It's the higher users, typically, people that are in the healthcare system a lot. Now, you're also getting the attention of everybody at the group. Everybody wants a lower deductible because you don't know what's going to happen to you that year. But this is a great way to lower the healthcare costs for that employee that meets the wellness goal. And from an employer perspective, it's an unfunded liability. They're not giving out that money unless people actually use the healthcare system. So another way for them to maximize their wellness incentives through this type of program. So I just want to highlight some of the results that the employer gets. And you, as the broker consultant, you also get access to some of this data as well on an aggregate level. So you can see what the sleep scores are for this particular group, right? Are they high risk because people are not sleeping enough at night? What's the BMI level of this specific group? Do we need to focus on healthy eating presentations and getting people exercising more? So these are just a couple of snapshots of some of the reports that are available for our employer groups to run in our back office system. There's a really detailed report. Steph, is it like 20 pages or so, right? There's a lot of data they get.
Yeah, it's almost 20 pages, and it's a really detailed report that shows the employer just a snapshot of that health assessment the employee filled out. And this is what's really great, because now that you know that, okay, there's, you always want to take care of your employee well-being, but now you can actually identify the problem that is in your organization. And what's great is that you can work with the Difference Card, as we have health seminars and our wellness portal that really tries to provide solutions to some of these health problems that you see. So if I was reviewing this with an employer and I was like, okay, we've been focusing a lot of time on diabetes prevention, which is great, but maybe we can just include and shift some of our educational material on your employees getting enough sleep at night, because we know that if we're not getting enough sleep, we're not going to be as resilient the next day and productive in our workday. And so we have seminars in-house, our live wellness webinars that we do monthly that can really focus on some of these problems, and we can work together in producing solutions.
Great point. So let's talk now about the results that this employer saw. And their first step was to get engagement, right? And over a long period of time, again, we were talking about a 3-year period, we saw massive engagement from this population. So when we started with them, they didn't have any wellness program at all. And we were able to get about 80% of their group to at least do something, get one of the two, a physical or the health assessment. So really great engagement, and even higher than that prior example, right? Because this was simpler. They just had to do one of two things to engage in the program: get a health assessment or get their physical exam. The physical exam was one key thing for this customer. They were actually in the healthcare industry. They wanted to make sure that as many people as possible were getting an annual physical. So when we think about like the national averages, only 20% of employees typically get a physical. Seems really, really low still. We were able to get this group up to 75% of their membership getting an annual physical every year over a 3-year period. And that's because of the incentive structure. It's the education of the program, the engagement. That lower deductible was definitely a big factor. And when they looked at their results, right, part of it was the difference card, medical expense reimbursement funding strategy. It's a pretty large organization. They had 500 employees. We lowered their healthcare spend, lowered their healthcare costs by almost $1 million over that time period. So really amazing results for this customer. They got their employees healthier by getting physical exams once a year. They got some data based on the health assessment, and they ultimately lowered their costs using the funding strategy combined with that wellness program. All right, Taylor, why don't we go back to the poll and let's see what the audience has found to be effective from an incentive perspective.
Yeah, so excited to share these results with you guys. Just to remind you, the question was, what wellness incentives have you found to be highly effective? There was a really good mix here. We had 35% saying premium contributions, 15% use gift cards, 40% are choosing to go the benefit enhancement route, 15% with HSA deposits, and this was impressive to me, 40% with paid time off.
Interesting. Yeah, I mean, we saw that paid time off in the PwC survey as well. That's definitely something that I think people need now, and that's a great incentive. So that's a good transition over to our third case study, which is actually the Difference Cards Employee Wellness Program. This is for our personal staff. Wanted to just showcase what we're doing for our employees and how we incentivize them. And we have made it robust, but we've also tried to keep it simple. We don't have all those different points systems that some of the example one had, but it's a little bit more than the simple structure that I showed you in example two. So for our staff, we want to encourage them to get an annual physical, and we reduce their deductibles by $50. We want everyone to get an annual flu shot, and we give them a $50 deposit into their HSA if they're in that plan. And Difference Card has two options. One is HSA compatible, the other is not. So for the non-HSA compatible group, they get $50 that they can use for IRS eligible expenses in the healthcare world. We did use that PTO holiday incentive as well. And we're encouraging our staff to get the COVID vaccine, and we're actually giving them Christmas Eve, which is next Friday or 2 Fridays from now. They get that off if they get the COVID vaccine and submit proof of that. And then finally, we rolled out in the past year the Goodcell diagnostic testing kit for our employees to encourage them to get some more information about their biometric levels, get some genetic information, and the company is paying for that. So as Maria goes through her part of this presentation and explains in more detail about the Goodcell program, you'll see that's not the only option. The company doesn't have to pay for it. A lot of our customers are offering the Goodcell program and just allowing employees to pay for it. But an effective way to get high levels of participation into the Goodcell program is for the employer to subsidize some of the cost of that kit. And with that, I'm going to turn it over to Maria and let her start to talk through some of the details of the Goodcell program.
Thanks so much, Chris. Appreciate it. Everybody can hear me okay?
Yep, all good.
Excellent. Okay. All right. Well, thank you again, Difference Card, for having us today. And thanks to everyone on the call for spending some time with us. So Goodcell, as you can see here, is an FSA HSA eligible way to identify, track, and mitigate health risk. We are exclusively focused on medically actionable data. So we're only testing and delivering data to the plan participant or consumer that he or she can take action on to improve their healthcare, and ultimately to avoid a negative outcome. We do this with a unique combination of curated diagnostics, advanced genetic testing, and personal biobanking for stem cells. And if we go to the next slide, thanks for driving. One of our biggest differentiators in the marketplace is that we are a blood-based test, and there is significant differentiation in value in that. And so as you can see here, a couple of things that I want to point out that are significant in terms of a blood-based test versus what you see in the market in terms of DTC tests that are saliva-based. So for starters, with blood, there is more accuracy and a more thorough test than a saliva-based test. You get test results that stand alone, that do not need additional verification or confirmation from a lab. We are a lab, and so there's not additional testing required. If you were to take a Goodcell test to a physician and say, this is what I found, what do I do next? Blood, of course, enables the biobanking. So with blood, we do personal biobanking, and blood is a rich source for a variety of cell types that ultimately can lead to curing disease. And lastly, but not least, blood enables a more efficient approach to curated testing that offers efficiency, but also a more holistic approach to preventative care. And then secondly, if we can move to the next slide, the second thing I would point out in terms of differentiation is that we move beyond the simple identification of risk to track the progression and regression of disease and ultimately help to mitigate, an adverse outcome. And so with that, we can look at the three different segments that I mentioned of our core product. The first on the next slide is the first set of results that you get. If we can flip to the next slide, please. The first set of results that you get as a member is the result of your annual baseline health panel. And this is a test that looks across cardiovascular and diabetes and vitamin D, excuse me. And interesting points from Chris and team about annual visits to the doctor's office. So we all know that approximately the 70% from that one client is amazing. I think it was 70% that you said. But we all know that the average is very low, right? So the average number of people going for that annual physical is about 20%. And of those people, not necessarily everyone is getting blood work. Now, we're not looking to disrupt the patient-physician relationship. We're looking to complement it. And so what we think it's more powerful, for example, for a patient to walk into their annual physical with blood work in hand and have a conversation about it versus doing it after the fact. And so we go a little deeper than what someone might get in an annual physical. So yes, we look at diabetes, but we also look at prediabetes. There are upwards of 80 million people who are pre-diabetic, and the vast majority of them don't know it. So we want to catch those people before they're full-blown diabetic. We look at cholesterol, but we also look at high sensitivity CRP, which indicates other more serious cardiovascular issues, and of course, vitamin D deficiency. So it's a really nice curated test that as a member of Goodcell can be repeated year over year, again, for progression and regression. And if we go to the next slide, the second set of results that you'll get is your genetic testing. And I say advanced genetic testing because, again, we go beyond what is yielded from a saliva test that you might find in the DTC market. And so this is a test that comes to us from the American Academy of Genetics and Genomics, defined by them as being medically actionable. It looks at 59 genes that reveal up to 31 predispositions across oncology, cardiovascular and metabolic disorders. And we'll see in any given healthy population about 2 to 3% of folks having a predisposition that's revealed by this test. In the very near future, in 2022, we will see the ACMG 73. And so there will be 73 genes that will be looked at, and that's a test that we'll have available next year. So this is, as opposed to the annual, a one and done. So you take this test and it's showing you all your predispositions. And last but not least, on the next slide, is personal biobanking. So Goodcell is the only company globally, in the US and globally, that offers consumers a way to store their biomaterial. So certainly this is done in aggregate for research purposes. But with Goodcell, you as an individual consumer can take your biomaterial, we store cells, DNA, and plasma, and bank it for the future should you need it. And on the next slide, we can see that for now, while there are only a handful of stem cell therapies that are approved by the FDA, there are nearly 800, I think it's 793, there are nearly 800 stem cell therapies in active clinical trials, and the FDA expects that by 2025, which is right around the corner, that they will be approving between 10 and 20 new stem cell therapies annually. And what we have seen in proprietary research that we fielded this year is that 1 in 2 US adults may develop a disease that will benefit from stem cell therapy in the future. So when you purchase Goodcell and become a member of Goodcell, your biomaterials, including your stem cells, are banked for the future should you need them. And if we go to the next slide, I think, yes, we have pricing. So what does this all cost? As I said earlier, Goodcell is FSA, HSA eligible. We are a CGIS approved product. And so for the genetic testing, the health screening, and personal biobanking, there is a upfront fee of $848. And then there is an annual fee for ongoing testing. And when you purchase that ongoing testing with an FSA or an HSA, your storage is complimentary. And I should also note that if you do purchase through the Difference card, you have access to promotional offers and discounts that are exclusive to the Difference card. And so if we can go to the next slide. Right. And so what does this look like from the member perspective? So when a participant purchases Goodcell, they do that right on our website, goodcell.com. The first thing that happens is they get a kit in the mail. So we are kit-based. We do partner with Quest Labs. So when it's time to go for blood draw, consumers can go to one of any of the 3,000 Quest Labs across the country. And if for whatever reason they maybe live in a remote area or don't want to go to Quest, we do have an at-home phlebotomy solution. So they can do an at-home draw. Test results are received and stored in a member portal that members have access to and keep that. You can share with friends and family. You can share with physicians, and you can house those results in the portal as long as your membership. Your materials are banked in our facilities. I should mention that those facilities are CLIA-CAP certified, which basically means that it's the same level of accreditation as you would see with an NIH or a CDC lab. And really, that's where the journey begins. This whole process, which we call the blood journey, the member is really, the customer service really holds their hands throughout. And then when results are received in that portal, there is a lot of access to resources, content, information, and of course, complimentary counseling with a genetic counselor. So lots of support along the way. On the next slide, I'll just touch on privacy.
Hey, Maria, I just wanted to chime in on the customer support side of this. I'm personally a member. I took a part of our program, and I got a phone call from one of the customer support people outbound. I got an email. They even helped me to find the right lab to get tested. So really, I feel the Goodcell team has gone above and beyond from a customer support perspective to make sure that we're comfortable getting that kit and the blood draw fulfilled, and then even walking you through test results. Really amazing.
I'm so happy to hear that. That's awesome. Yeah, our member, we call them our MRMs, and they do an incredible job. So thank you for that, Chris. So a quick note on privacy and security. Obviously, these are paramount issues to us at Goodcell, and we do have a best-in-class experience and offering there. So to start with, our proprietary platform is built on blockchain technology and network isolation. It is a very secure platform that you would find in big technology and/or finance. Secondly, in terms of privacy, we would never sell or share individual level data. So that goes, you know, if an employer is running this program, for example, we could share data, de-identified data in aggregate, but would never sell or share individual level data. And that gets us to our last point, which is that the data is in fact de-identified. So, oh, sorry, back one more, really quick. So when you get your blood draw, or you go to Quest Labs, or the phlebotomist comes to your home and that blood is drawn, nothing with any PHI goes to lab. So it's scrubbed of all personal information and de-identified. So it's a very secure process. And so now we can go to the last slide. And so in summary, it's our goal at Goodcell to, as we say, add years to your life and life to your years. And we're focused on helping to improve outcomes, reduce costs, and deliver a high value, eligible participant experience. Happy to answer any questions. I don't know if we want to do that at the end or.
Yeah, thank you, Maria. I think that was a really informative deep dive into how the Goodcell program works. And I'm sure our broker partners probably have a lot of questions that we might do in follow-up sessions. We can take a couple of minutes too. If anybody wants to put a question in the chat or the Q&A feature, we can certainly do that.